Fatal doses of ethanol: 1 pint approximately 550 or quarter, 2 pint approximately 1100 ml of a strong distilled spirit such as a whiskey taken in a short span of time can be lethal. The usual fatal dose corresponds to approximately 6 gram of ethanol per kilogram per body weight, 3 gram per kilogram for a child. In terms of blood alcohol, a level in excess of 400 to 500 milligram per 100 ml is usually considered to be lethal. However, there is a great deal of controversy regarding this, since there are cases reports of individuals succumbing to too much lower blood alcohol concentration, while there have been reports of survival even with a blood alcohol concentration of over 1000 milligram percentage ethanol concentration. Already told. Toxicokinetics. Ethanol is toxic by oral inhalation, subcutaneous, intravenous, intra-arterial, intraperitoneal, dermal route. Following oral administration, ethanol is rapidly absorbed from the stomach and the small intestine. Maximum or a peak alcohol concentration in blood is reached in 30 to 90 minutes following the last drink. Many factors can delay absorption undiluted ethanol by provoking pyrospasm, presence of food, delayed gastric empty due to any cause, presence of congeners in alcohol. Vaporized ethanol can be rapidly absorbed by inhalation, leading to intoxication. Following an individual dose of ethanol, a woman achieve a greater blood alcohol level than do men as a result of decreased gastric alcohol dehydrogenase activity, this enzyme activity. It is also a fact that liver damage occurs after consumption of relatively smaller quantities of alcohol in a woman as compared to men. More than 90% of the ethanol is metabolized in the body, and only 5 to 10% is excreted unchanged in the kidneys, lungs, sweat. Excretion of ethanol by the lungs obeys Henry's law. The ratio between the concentration of ethanol in the alveolar air and the blood is constant. This alveolar blood constant 1:21,000 forms the basis for reliably estimating blood alcohol concentration by breath analysis. Metabolism of alcohol is accomplished through three pathways in the liver: alcohol dehydrogenase pathway in the cell cytosol, microsomal ethanol deoxidizing system, that is MEOS CYP2E1, located on the endoplasmic reticulum, peroxidase catalase system in the hepatic peroxisomes. The first is the main pathway, while the third is the least important. That is, alcohol dehydrogenase pathway is there, microsomal ethanol oxidizing system is there. In the alcohol dehydrogenase mediated pathway, the hydrogenase is transferred from ethanol to NAD, reducing it into NADH. The ratio of NAD to NADH redox potential is therefore dramatically altered, which contributes to the development of metabolic abnormalities such as alcoholic ketoacidosis, impaired gluconeogenesis, and alteration in the lipid metabolism. So, this metabolic abnormalities such as alcoholic ketoacidosis, impaired gluconeogenesis, impaired the gluconeogenesis, and alteration in the lipid metabolism. The acetaldehyde that is formed by converted to acetic acid by aldehyde dehydrogenase, which in turn is converted into acetyl coenzyme A and enters the Krebs citric acid cycle, which is metabolized to carbon dioxide and water. MEO system becomes important when ethanol use becomes chronic. The ability of the ethanol to simulate the MEO system forms a basis for the interaction between ethanol and a number of other drugs metabolized by the system. Half-lives of several drugs are shortened in chronic alcoholics because of accelerated metabolism. Example: phenytoin, methadone, tolbutamide, isoniazid, warfarin. There are also indications that chronic ethanol abuse may potentiate paracetamol hepatotoxicity. Adults absorb 80 to 90% of ingested alcohol within 1 hour. On average, metabolized it in a rate of 100 to 125 milligram per kilogram per hour, reducing blood concentration by approximately 150 to 200 milligram per ml or per hour. Tolerant drinkers metabolize ethanol at a higher rate, therefore blood concentration fall more rapidly. Volume of distribution for ethanol is 0.4 to 0.6 liters per kilogram. ADH alcohol dehydrogenase is saturated at relatively low blood ethanol concentration. As the system is saturated, ethanol eliminate the changes from first order to zero order kinetics. In adult, the average rate of ethanol metabolism is 100 to 125 milligram per kilogram per hour in occasional drinkers, up to 175 milligram per kilogram in habitual drinkers. As a result, the average sized adult metabolizes 7 to 10 gram per hour. Blood ethanol concentration falls 150 to 20 milligram per deciliter per hour. The tolerant drinkers, by recruiting CYP2E1, may increase their clearance of ethanol to 30 milligram per deciliter. Studies of ethanol intoxicated patients indicating that although the average ethanol clearance rate is about 20 milligram per deciliter per hour, there is considerable individual variation. Standard deviation of about 60 milligram per deciliter per hour. As an important point to remember with reference to Asians is that nearly 40% of the population may harbor an inactive alcohol dehydrogenase variant due to point mutation in alcohol dehydrogenase H gene, which significantly reduces the capacity for acetaldehyde metabolism, leading to severe flushing reaction in such individuals even with a relatively small amount of ethanol. Thank you.